There is pre-op evaluation by physical therapy that I have. There's a post-op program that we've set up as well. We get you in the pool at about 2 weeks after surgery, which really helps with the physical therapy after. We do a basic land-based program starting about a month after surgery. Physical therapy generally lasts about 6 weeks after, I guess, yeah. I mean, it'll vary kid to kid. But after coming out of the pool, a lot of kids are so flexible that the people at the floor say, oh, I don't even know what we're doing here, although it always helps. And then it's about 3 months to heal and about 6 months before you're really just jumping up and doing everything that you want to do. But we do as much as we can to get the kids moving forward as quickly as they're able. Teamwork doesn't start when it's in the hospital. It doesn't stop when they leave the hospital. It's all working behind the scenes, but that's the main intense period. So it's during the surgery. So I guess that's it for the presentation. Anything to add? Okay. So we will open to questions and anything that raised your interest or anything you want more information about. Yes.
Like during the surgery, where are the parents?
That's a good question. During the surgery, I don't know actually. Because I'm with you.
They're partying. They're responsible for that.
I call them when we go back to surgery. They'll go out to the waiting room, and then when we get in the room when he makes the incision, I call them and I talk to your mom or your dad, and I say, we just made an incision, so don't be worried. It'll be 30 minutes at least. At least 30 minutes. Sometimes 45 minutes to an hour before I call you to tell you we made an incision. Because of anesthesia and because of all our setups. It could be anything, but it could be 30 minutes to 40 minutes because we're all focused on you. So if it's not safe, something's not safe, we're not going to do it. So it could take longer. But I will call you as soon as he makes an incision. And I will say, we just made an incision, so now this is the start of the time frame that he gave you, which is probably 3 hours to 4 hours. Usually it's under 4.
Yeah. And then when
he always gives you more.
When the instrumentation is in place, I'll call out as well and let the parents know.
And that'll be me calling out to you to tell you that all the instructions in, and he will be out to talk to you in about 30 minutes. And it'll be less than 30 minutes, but I always overestimate.
And in pre-op, you'll be given a beeper, and so even if you go to the cafeteria or you will check in with the woman at the in the waiting room, and you'll have that, so they'll be able to get in touch with you. They're always be able to be.
If you're not there, I'll leave a message to her, and when you come up to the desk, she'll tell you that I called out and called to tell you that.
There's no question that of all the jobs, the parents have the hardest because the child's asleep. We're all working. We're all pretty busy. We're the ones who are sitting waiting, and we try to make the waiting room reasonably comfortable. I had you stay in the day surgery waiting area for a couple reasons. It's much easier for me to contact you. I think it's a nicer space. There's windows. The intensive care in the inpatient waiting area has no windows at all. I don't know why they set it up that way, but the cafeteria is nice. The food here is pretty good for what it's worth. But I know that those 2, 3, 4 hours are the hardest time that any parent can spend. We're cognizant of that. We used to try to call out at regular intervals, and what we find is that we got caught up with something and we didn't call out, and the parents tended to panic. So it's better for us to say, okay, we'll call you out at the milestones instead. And I think hopefully most parents are pleasantly surprised by how quick the process goes. But it is a hard day, there's no question. And hopefully knowing that who's working and what we're doing will make it a little less hard for you. That's another reason for this session today. That's a great question. Any other questions at all?
Before the surgery, is there something that the child can do to prepare?
Oh, there's a whole bunch of things that the child can do to prepare, absolutely. I might let Mara address that?
Sure.
That's a good idea. Sure.
I need to talk about that.
Yeah.
So, I had surgery 7 years ago, so it's a little bit different, but not drastically. So, I would really strongly suggest to practice log rolling in bed before you have surgery. It's how you'll get in and out of bed after surgery, which I wish I had tried that before my entire body was shifted. That would have been really good. I also think that doing some core strengthening before surgery can be really beneficial and makes the recovery a lot smoother. Because you'll have physical therapy afterwards, of course, but I think having a little something beforehand just kind of gives you an extra leg up, so to speak. And what else? I think those are the big points.
Calories, coping.
Yeah. Make sure that you eat a lot. I had milkshakes every day to try to gain a little weight before surgery. In terms of kind of the emotional side of it, I think it's really important to reach out to other people for it. I know it's helped a lot of people. When I had the surgery, I only knew one person who had had the surgery, and they didn't really know that much about it. They're like, yeah, I just sort of had it, and then I went home, and some more stuff happened. So I think it's really important to be able to connect with other people, because everybody's experience is different. It's really good to be able to kind of get a hold on the different aspects, get a very personal side to it, because Dr. Mankin and all these people are awesome, but to my knowledge, they haven't had the surgery. So they can't tell you like what it feels like, how things are different. So knowing what to expect, like for instance, walking the first time, I was convinced that I was falling backwards. I was convinced I was walking like this, when in actuality, I was walking like this. But since my balance was off, I just felt like I was falling backwards. So knowing things like that, knowing that that's okay, that that's not something completely abnormal that nobody else has ever had, is really comforting to know as well.
We do have some information that leading up to the surgery we give, things to suggest. It's nice to bring things to the hospital that your child will be happy with. Very important. One of the problems with the catheter is you can't put on normal pajamas. You can put on a nightgown, but you can't put on normal pajamas for a while. But to have that wonderful, comfortable pair of sweatpants or shorts or whatever that your child wears all the time, just to put on, that's a great moment. In fact, I think that may be the best moment of the week is Wednesday morning when the child can finally put on their own clothes. That it's really important to do that. We talked about stuffed animals or toys, nothing too elaborate, obviously. The one thing, books, maybe not the greatest idea because you're not going to have a lot of concentration, but puzzle books, things like that. You really want to get the child in the comfort zone as much as possible, and to know when she's in the room that it doesn't feel, that the whole thing doesn't feel like a totally foreign room. It is, obviously, it's totally alien. But if there's a little corner that she looks at and she says, oh, this reminds me of home, that's going to be really important. So putting a little planning into that beforehand is really important.
Even small things, like a pair of fuzzy socks, something small like that that you wear at home that you just really like. Something, it doesn't have to be like this massive grand change of the whole room. But yeah, I had fuzzy socks, and they had little grippers on the bottom, so that when you walk, you don't slide, which is really helpful. Because I'm pretty sure I would have gone flying without that.
I'm glad you did.
Yeah. Yeah.
Any other questions at all?
We've gone to great lengths in the on the pediatric floor to make it a welcoming environment and have a lot of entertainment options for our kids when they're there. We've got an iPad, we've got iPods. Every room has internet access. You can access the Facebook accounts. Like you'd be surprised how fast your status is updated after surgery. Cell phones are allowed. I'm always like, where's the phone? So you can hand it to them so they can text their friends if they're fine. That's a teenager kind of thing. Parents, there's all the chairs full out to a bed. There's full showers there. Can't make, it's not your own bed. So sorry. But we're trying. And there's a Ronald McDonald room around for parents to go there. There's internet access also in there. It's just a quiet place with a washer and dryer. They provide food and snacks as well for you, so you can just take a break. And only parents are allowed in there, so you're not going to hear other people's children crying or whatever. It's just a quiet place to get away. We've got movies. It goes on and on with what amenities we've put into these rooms to try to make it less like a sterile hospital environment and more like a teenager's room is what it feels like. It's so many electronics everywhere.
The new hospital is fantastic. I apologize to Barbara because she had her surgery in the old hospital. She's always
I can't tell you how much better the new one is. The old one was kind of like a closet.
Yeah.
So.
It's night and day. Judy?
These are one patient to a rooms?
Yes.
Oh, yes, right. There are no ballrooms or anything. Even the unit is one patient.
Generally, you stay overnight 2 nights?
Stay overnight 3 nights.
3
So I like to say in Monday, usually out Thursday. We don't kick you out Thursday. We won't throw you out kicking and screaming if you need to stay over Friday. I've very rarely had people able to go home Wednesday evening. It's probably not optimal, but there's some people who just really want to get out, and they did okay. I mean, it's nice to have that extra day and just the security of knowing that you're all safe. The extra physical therapy time.
The therapy time's important.
Yeah, it really is. Our therapists are great. I wish they were here, but they will come generally twice a day.
It's important to remove yourself as a parent from a lot of the circumstances that are going on because there will be frustration from the kids. And the kids do better with the outside person than they do with the parent that's involved sometimes because they're too close to the situation. So that I found that the case for most of the helpers.
It's a lot more fun to tell mom no than to tell someone you don't know.
They won't say no to the therapist,
Yeah.
but they'll say no to us, yes.
But we do certainly encourage parents' participation.
Oh, yeah.
In fact, that's important. So we don't want the parents to just wander off and spend the whole day in the cafeteria. So we want you there. So. And even though your child may not say it, your child wants you to too. That's a very vulnerable time for her. So.
And then after the surgery, is it evident that there's an appliance?
No,
No,
you
not at
you can't see the metal at all, or I mean you can't see even the contours of the metal. Obviously, there's an incision. Incision is right down the middle of the back. There's sort of a natural sulcus there, anyway, natural cleft. And so by the time it heals, I won't say it's invisible, but it's pretty darn hard to look. You have to know what you're looking for to see it.
It's a huge difference between, she's almost 3 weeks, between the 3rd week and the 3rd month. Some of the swelling and stuff is still on her. You can still see a little bit of an indent, a raised area, but there's no metal. But you look at somebody at 3 to 6 months and it's hard to see.
And by a year, you almost can't see the scars. Yeah, I often tell people this is a great operation to have had done. It's not a great operation to be going through because there's a lot to it and a lot of work that the child has to do, a lot that the parents have to do. But I think it's very satisfying. You know you're done with the things pretty much, and it's. I think that once it's behind you, it's a very, very good operation, literally behind you. So. Okay, anything else? Yes.
Is there maybe, I know the treatment now is with rods and screws and that. Has there been any research towards maybe an alternate?
There's been a lot of research into alternate things, but nothing's really panned out. There's a whole bunch of things that they're looking at doing. They're trying to get the rods to sort of self-correct. And so they're trying to use different materials. They've tried to use cables instead of rods so you get better flexibility. Unfortunately, that hasn't worked. There's been some looking at some plastics or ceramics, which may have some promise in younger kids, but really is not necessarily helping with older kids. The problem is you need the rods and the screws to do the correction, but you don't need them for the fusion. I think probably what we'll be looking at in the future is a setup where we get rods that are in as long as they need to be, say 6 months to a year, but then dissolve so that you're left with just the fusion. because who needs all that metal? So that's something that may or may not come out. We've had problems with the dissolvable metals so far. So, yeah, there's a lot of things that are looked at. It's just, this is where we are, state of the art right now.
And then long term, is there continuous medication? Treatment?
Usually not. I mean, the one thing that never goes away is the need for being physically aware of what your back is. Your back is stiffer, no question. Everyone who's had the surgery would tell you they feel a difference in the way their back works, although it's sometimes kind of invisible, and you'd be amazed how much flexibility. I had a young lady come in, she's about 6 months after the surgery now, and I said, okay, bend forward. And she bent, she just kept going. She kept going, touched her elbows on the floor. And how do you even do that?
You can do it before the surgery.
Thank you.
That's key.
But the thing is that as you get older, your muscles are less flexible. That will be an issue. But it's an issue that generally can be taken care of with physical therapy, staying fit, staying active. The great thing about this population is they're almost all like this. They're almost all trim, fit. They don't stay young, unfortunately, but they're young at heart. But if they can maintain that, it makes a huge difference. So staying active, being careful about how you lift things, about what kinds of things you want to do. I joke with people that there aren't really restrictions, except I don't want them to grow up and play professional football, and I don't want them to be piano movers when they get older, although they could probably be piano movers if they wanted to. I just joke about that. And nothing, I hope none of you are piano movers. It's not, wasn't a value
Professional
joke.
skydivers, right?
Yeah, that's right. I try to keep them away from the
Professional
skydiving.
skydiving.
Or if they're going to bungee jump, I just don't want to know about it. But the main thing is to just make sure that they're aware of their back. They will have pain, and I'm sorry to tell you girls, at intervals through life. Now, the studies, if you look at it, say that the kids who don't have them fixed have much worse pain going through life. And so the intervals when they have them are less frequent, they're easier to treat. They just mean exercise, maybe a little bit of anti-inflammatory. But most people are not on anti-inflammatory all the time. Most people do not need medicine all the time. So it is very well tolerated. I think the secret is we maintain the discs as opposed to what happens in adults, the discs being the spacers and the shock absorber. So even though I've fused the spine, there's still shock absorbance there. So they actually do much better in the long run than you would expect. And in fact, by correcting the spinal alignment, the discs do better longer. So I think that's why.
How old are the oldest people who have had this?
Oldest people of my group, I've been in practice for about 18 years. So they're probably, well, I know there are a few in their 30s. I don't talk to them all the time. I've moved at least once, and so I've lost some track of them. Although every so often I'm pleased to run into one and say, my back is great. Or occasionally someone, my back is hurting some, what should I do? This surgery has been done for probably 60 years, at least some variant of it. And so the literature tracks people from, from the age of 12 or 13 up to the age of 50 or 60 and sees how they are. So I just don't have anybody in my practice now. Okay. Well, thank you all for coming, and thank you again for allowing us to be here.
Thank you so much, everybody, for coming. We're really, really glad that you came. If you don't mind just kind of hanging out for just a little bit, maybe parents can mingle, ask specific questions if you have any.
I'm going to put in a plug. If you're curious to what the OR looks like, in October we do an open house. It's not really for back surgery, although I think there is one back room, but each specialty has a room in a certain part of the OR. And you walk through pre-op, and they tell you what happens in pre-op when you have surgery. You walk through the OR, and you walk through each room, and they tell you that you see certain setups for certain surgeries. And then you walk out in like a PACU recovery area, and they tell you what happens there. And then we usually have refreshments, and then you leave. Well, I mean, it's in groups. It's not all together. If you're ever curious about what happens.
Well, one of the nice things that they don't do at some of the other hospitals is the pediatric for the scoliosis surgery. the pre-op is a day camp. And we go through all of the stuff for about 4 hours of being here. And that was really nice for the parents to get oriented in the hospital and for the children to be able to see from the PT stuff to the recovery and some of the other things that they'll be going through. And a lot of the other hospitals do standardized pre-op. They don't do an orientation. And the orientation has, I can't express. They should do that for all children's surgeries. I don't know if they do. The child specialist takes you on the tour and does all the stuff with you. And then we have our little meeting with Trey. But
I'm sure.
it's all part of that, which is nice.
All right. Well,
Super.
if you want to mingle. There's coffee still. There's donuts.
Please
hot
eat the
food.
donuts.
There's